Good morning, my dear students. In the last session, we studied about health infrastructure and the state of health infrastructure in India. Today, we will discuss about indicators of health and health infrastructure. Global burden of diseases. GBD is an indicator used by experts to gauge the number of people dying prematurely due to a particular disease, as well as the number of years spent by them in a state of disability owing to the disease. In India, expenditure on health sector is as 4.7% of total GDP. This is very low as compared to other countries, both developed and developing. One study points out that India has about 17% of world's population, but it bears a frightening 20% of the global burden of disease. In India, more than half of GBD is accounted for by communicable diseases such as diarrhea, malaria, and tuberculosis. Every year, around 5 lakh children die of waterborne diseases. The danger of AIDS is also looming large. Malnutrition and inadequate supply of vaccines led to the death of 2.2 million children every year. At present, less than 20% of population utilizes public health facilities. Only 38% of the PHCs have the required number of doctors and only 30% of PHCs have sufficient stock of medicines. PHCs means primary health centers. Urban, rural and poor-rich divide. People living in rural areas do not have sufficient medical infrastructure, which has led to differences in health status of people. In rural areas, the percentage of people who have no access to proper healthcare facilities has increased over the last few years. Villagers have no access to any specialized medical care like pediatrics, gynecology, anesthesia, etc. Though 70% of India's population lives in rural areas, only the one-fifth of its hospitals are located in rural areas. Rural India has only about half the number of dispensaries. Out of about 6.3 lakh beds in government hospitals, roughly 30% are available in rural areas. As far as hospitals are concerned, there are only 0.36 hospitals for every 1 lakh people in rural areas, while urban areas have 3.6 hospitals for the same number of people. The PHCs located in rural areas do not even offer X-ray or blood testing facilities. States like Bihar, Madhya Pradesh, Rajasthan, Uttar Pradesh are relatively lagging behind healthcare facilities. The poorest 20% of Indians living in both urban and rural areas spend 12% of their income on healthcare, while the rich spend only 2%. Women's health. Women suffer many disadvantages as compared to men in the areas of education, participation in economic activities, and healthcare. The deterioration in child sex ratio in the country from 927 in 2001 to 914 in 2011 points to the growing incidence of female feticide. Close to 3 lakh girls aged below 15 years are not only married but have already born children at least once. More than 50% of married women in age group of 15 to 49 years have anemia and nutritional anemia caused by iron deficiency, which has contributed to 19% of maternal deaths. Abortions are also a major cause of maternal morbidity and mortality in India. Suggestions to improve the effectiveness of healthcare programs. Decentralization of public health facilities. Health is a vital public good and a basic human right. All citizens can get better health facilities in its public health services are decentralized. Sound health infrastructure. Success in the long time battle against the diseases depends on education and efficient health infrastructure. Primary health care. The effectiveness of healthcare programs also rests on primary health care. The ultimate goal should be to help people move towards better quality of life, reducing the gap between urban and rural healthcare. There is a sharp divide between rural and urban healthcare in India. If you continue to ignore this deepening divide, we run the risk of destabilizing the socio-economic fabric of our country. Accessibility and affordability of basic healthcare to all. In order to provide basic healthcare to all, accessibility and affordability need to be integrated in our basic health infrastructure. Thank you.